Good afternoon.
Hi, Sonia. Good afternoon.
Hey, Sonny, how you doing?
Good. Who all do we have on here so far? Deidre, Ernestine, somebody in
Hi, Sonny.
Navajo. Hi.
This is Claude.
Hi,
Oh, okay.
Claude.
Hello.
Hi, Claude. We can hear you.
Hello, this is Gail.
Hi, Gail. How you doing?
Hi, Gail.
Hello.
Hi, Lakeisha. Hi, Rydell.
Okay, we'll give it a couple more minutes so people can join.
Hello, sorry.
Hi, Cheryl.
Oh, hey, Cheryl. How you doing?
I was in the month of December and my laptop, I was like, what time is it? My laptop wouldn't send me the notification and here I looked at it. I was in December. Oh
Hi,
gosh.
Carol.
Hi.
Hello,
Hi, Carol Mullet. How are you?
I'm fine. How are you up north?
Pretty good. Oh my gosh, talk about chill of an early fall. It was cold this morning.
Yeah, wear a jacket.
Not yet, but pretty soon, I believe.
Well, that's good.
Yeah, it feels good though. Anyway, hello to everybody else that has
Hi,
joined us on the
Diana.
call. Hi, Diana.
I think we're waiting for Marie and maybe a couple others.
Oh, okay. Awesome. Well, I hope everybody is doing well. It is quite a busy time.
It is a bit busy.
And can everyone on the call see my screen okay?
Yeah, your tall aspen trees.
Oh, you can't see the presentation?
No, I don't.
I don't
see
either.
access my desk.
Hi, Joni.
Hi.
There you go,
How
Kevin.
about-
Hi,
okay.
Joni.
Hi.
Yeah, we got it now.
Perfect.
I was just listening to that music. Who's on KTNN?
Hey, Cheryl.
Hey, Riddell. Or is it KTNN? It sounds similar to this, to
Yeah.
this. Oh, is it? Oh, okay.
It's
Yeah, I
heard
was
on
listening to
before.
that too.
Yeah, it's arcane to be here. Our chairwoman, she's on the radio now.
Oh, okay.
They have their hour.
So is everybody all ready for this to give us some really good feedback from you, from collaborating with each other regarding this topic?
I am. Carol.
Yeah,
Hi.
I'm all ready too.
Come on, you guys, we got to get all energized here. So it's 1:35.
Yeah, let's
Shall we get started?
Yeah. So
I know Rachel's not going to join us till a little bit later, right?
correct. Yeah, she said
Oh,
maybe
okay.
around 1:30 or 2. Yeah, or 2, I
Cool.
guess. Yeah.
Okay.
So yeah, let's
All
start
right.
off. So everyone, thank you so much for joining us. We have this entitled the Interactive Tribal Plan Collaborative. Obviously, as the name says, we want some interaction from all of the different tribal plan staff. We don't want to drive the meeting, but we will have a couple of topics that we're going to go over first. Cheryl is going to cover risk assessment. We've got a person-centered planning video that Rachel selected. We'll watch that. And then Sonny will go over the person-centered goal setting. So as we've done kind of our surveys and we've reached out during our meetings, these are the two topics, at least for the person-centered planning form itself, the sections that were kind of the most popular, I guess, in a good way and a bad way. Just trying to get some information and clarification on these two areas. So again, we're gonna briefly go over those, and then we're gonna move to the more interactive part of this, which is basically we would like everyone to kind of share information about what your progress has been since the implementation of person-centered planning. It doesn't necessarily have to be the form, even though we'd like to know how that's going as times have been reduced, kind of the tricks of the trade. I know we've learned a lot from the different meetings of how different staff have come up with kind of innovative ideas to cut down the time and kind of consolidate questions. So we'll go over that as well. And then we will just basically go over any planned programs, initiatives that you have, even if you're thinking about them, ones that are in the works, in development, and of course, any that are actually in practice. I think it helps us immensely to see what is being developed out in the different plans, and then we can kind of get an idea. And it's for us to share that. And I think the impetus for this is that we would like this to kind of live on this type of meeting setting, not always that we will facilitate, but that would be that all the plans can get together and collaborate and share ideas. Because it's just amazing how many incredible ideas there have been throughout the programs. And I think sharing these from time to time, not really on the quarterly meeting basis, but just even on an ad hoc meeting. So that's kind of the purpose of the meeting. Again, we just want everybody to kind of be relaxed, Feel free to give any suggestions, ideas, that kind of thing. And that's it. So with that, I will turn it over to Cheryl.
Cheryl, we can't hear you.
Good afternoon, everybody at again, welcome and thank you for all RSVPing and setting aside a little time regarding the person-centered service plans. The first slide that I want to go over is just a reminder as to the important parts of what the person-centered planning, service planning is all about. Again, it's on build on the members' strengths, their life preferences, their support needs, and also including meaningful activities such as employment. This may relate to some of our younger tribal members that we have out there with disabilities, and even some older, because aging in general is becoming something that is so diverse now. There's chronological aging, which is our years, and there's biological aging as to what our life choices affect on how we are aging. So, Kevin, can I use you and I as an example?
Absolutely.
Okay, so Kevin and I are about, and I'll include Sonny, we're all about the same, around the same age. So I'm going to say, like, for myself, I am 57 years old. I am not active like I should be. I have a medical chronic condition or conditions, and I'm at fault and guilty of a lot of times not putting myself first and my wellness first. I really try hard, but it is a challenge. And then there's Kevin. He probably is a little bit younger than me, but in great shape because he used to, very active because he used to play professional soccer. So using us as an example, you think about the members the same way. You have to look at their chronological age and their biological age. And in our population, it's all about looking at what they've been diagnosed as, what you've read in their medical history, what you've received from the past assessment, the past summary, things like that. So employment, meaningful activities for employment, that could be different across the board. Community activities could be different. I'll take, for example, my mom. She's not a very sociable person anymore. She used to be when she could still see well and drive, but now she just chooses to be home. And with the public health emergency in place right now, and a lot of our state executive orders from our tribal leadership, a lot of our elders don't get to go. They don't get to socialize. They don't get to go to powwows. They don't get to go to song and dance. They don't get to go to chicken scratch or anything. And more importantly, next month is Native American Recognition Month, which is really, really important to all of us as Indigenous people. And so some of the things are being canceled. I know for our Navajo Nation, all the fairs were canceled, and that's a huge community activity for all our agencies. So that's not normal, what is normal to all of our elders. And then the other thing is volunteering and including also socialization in that. So every member has to be different, because what we all want as human beings, as the our five-fingered people are we want to be treated with dignity and respect. We we want to be included as anybody without a medical diagnosis or a medical condition, and we want to be safe in our daily activities of daily living. So that's kind of what person-centered planning we got to be reminded of, and always keep that in the back of our mind when we're going out and doing our assessments. Next slide. So also what we want to do and remember is to promote the individual's rights and independence. That is huge, and that really relates right now to what our topic is going to be about, and what you guys are going to be collaborating about is we don't want to take any of our members' rights away. But in some cases, sometimes that has to be a discussion that needs to be initiated because it's not safe for them. The other thing we want to do is promote the safety and wellness, and by giving them different options, by giving them alternatives to still be the driver in the vehicle of person-centered planning. And then their independence, and then also community inclusion, like the examples that I just gave. Next slide. So all those things are the things that are going to be important throughout the person-centered planning review assessment. And one of the things that we're going to talk about today, and I'm just going to start it off, is the risks. So if a case manager identifies a risk of all the things that were pre-mentioned of how we want to promote the members' planning, the members' service planning, the members' rights and independence, if the case manager assess a risk, then you got to go a little deeper, and then you have to do the risk assessment. What are you assessing in their environment, or what they're telling you, which is doing that interviewing of them to let them tell you what their preferences are, what their cultural beliefs are, what their goals are. And Sonny's going to touch on that later. But that's a risk assessment. And if there's something in there in identifying that risk, then that has to be acted on. And it can even go as far as, but it's not always the case, it can go as far as the case manager initiating the written, signed, managed risk agreement. So everybody following right there up to that point? If you don't, just put in the chat, or feel free to just interrupt if you have a question.
Raise your hand if you could. That would be good.
Yes, thank you. So when there's a risk, there is a risk when considering a restriction of the member's rights or the freedom for health and safety reasons. So you have a risk, the member is a diabetic, and secondary to their diabetic condition, they are now above the knee amputee. Okay, so that's the risk that you've identified. What you're then going to also want is when you're not going to allow the member to do something that people generally are allowed to do. So the member says, before I became an amputee, I used to do rock climbing, or I used to go herd sheep, but now they're an amputee, and they're not, unless they go through and coordinate care through referral process and get other disciplinary teams involved, that it's going to be safe for them to do that. Okay. Then they're going to review and then they're going to analyze what optimize the risk while allowing the greatest freedom. So you're not just going to say, well, you can't go herd sheep anymore because you're an amputee. And so from there, the risk is identified, the restriction of rights is identified. We can't take that right away from them. If they choose and they say, I want to herd sheep again, then as the assigned case manager, as a tribal health plan, you are going to do your best, your due diligence to try to make that happen for the member. And one of the things might be, okay, if you want to do this so-and-so, then let's go work together and let's get a prescription to have you evaluated by orthotics. Let's see if we can get the doctor, and out in Indian country, it's usually hanger orthotics. So that's just an example. I'm not trying to what do they call it?
Advocate.
Or advertise for them or marketing. So I mean, I just pulled that out because I always saw that. So the doctor would then say, you know what? And in his medical opinion or his medical expertise, he's going to say, yeah, I don't see why this member can't, herd sheep again. If that's what he wants to do, I'm not going to restrict him. I'm not going to take that right away from him. So the doctor writes a prescription for hanger orthotics to do an assessment for a prosthetic limb. So that starts going on. They get evaluated, they get measured, and then they usually don't just give it to them. It could happen. I'm not saying it never happens, but stranger things have happened. They could get that ordered, get it prior authorized, get the script, get it prior authorized. The hanger orthotics builds the prosthetic to the member's specifications. Then they're usually not just going to say, here, put it on and start walking. No, because they have to go through physical therapy for strength and conditioning with that new prosthetic limb. So all this is going on. It's going good. All of a sudden, let's say, then the member says, you know what? I don't like it. I don't want to do it. They get the limb, but then they say, okay, well, I don't want to go to physical therapy. I can do it myself. And they are adamant on not going to physical therapy. That is when you're going to say, okay, now this is going to lead to a managed risk agreement, because you as a case manager have already received the prescription from the doctor saying it's okay. You did all your part by getting the prosthetic for the member. Then the recommendable professional recommendation was strength and conditioning, reconditioning to help the member use that prosthetic so that it's safe to be out amongst the rocks and safe, fresh herding sheep. But he refuses PT. So then that's when you initiate a managed risk agreement, because what you want to do is you want to make sure that, first of all, you did not take his rights away to refuse that part of the case management services, but you are giving him the informed information of all the risks that could happen out there if he doesn't get proper strength and reconditioning therapy. I mean, he's not going to be there forever, doing that through PT or occupational therapy. They're gonna get him situated, get he or she situated. They're gonna, in their medical opinion, they're gonna say, you know, they're ready. This person's ready. They're ready in my medical expertise. They're ready to go home with and be out there independent in whatever they want to do. But the member said, no, I don't want to. That's when you have to do your managed risk agreement. Identify the risk, identify all the process that was going really smoothly going forward until he refused the PTOT portion of it. Then that's a priority risk, and when a managed risk agreement should be put in place. But it doesn't, just because you've identified a risk, remember that doesn't always go towards a managed risk agreement. It can go smoothly, and the member could say, okay, they go to PT, they go for their 2 months therapy, and the PT says, you're ready, you're ready to be independent, transferring, ambulating in your community. Then, that's right there, it's documented. And from there, that's when you continue with your next portion of case management, your next action plan. So when the managed risk agreement is in place, of course, you document. You develop all the risk that the member, that could affect the member's health and safety, and the result of what the member's decision was for their own choice. You offer all the alternatives, options to the member regarding the risks, the options, if it were placement or if it was other services that would be needed. Make sure you document. Then within the managed risk agreement, you must get a signature from the member or the authorized rep, guardian, and that signed managed risk agreement should always be kept in the case file. And if the member wants a copy, of course, you give the member the copy of the managed risk agreement. Any questions? Okay, next slide. So now that brings us to the review of the person-centered service planning section. And you guys are all familiar with this because you guys all got a manual from the training. And this is where all the codes are for how the coding of how you're going to identify the risks. Always remember there can be multiple risks. I know on the person-centered planning form, there's only 2 spots. I believe it was 2 spots for 2 risks. There may be 4 risks, but case management standards is you need to critically think and prioritize the risks. Okay? Remember that, prioritize, because a lot of our members, a lot of our population, they have more than one risk that you've assessed. But you just go ahead and also prioritize that. And that helps. If you prioritize, that will help in goal setting, which is going to be coming up next. So I don't know right now if I do know that there were a lot of questions on these areas, the abbreviations. So the ones that the ones that I think that I just now gave example are if there's one that you code as RR, if you've assessed it as being, as your members' rights are being restricted. This is the one that I just talked about in the previous slides. And Kevin has a nice little picture there of, okay, you know, the member there, he looks like he's all ready. He likes to rock climb and or hike. But what's the risk from jumping from one boulder to the next? You know, there's no safety. There's, you know, there is he wearing the appropriate footwear? All kinds of things. Are his clothing restrictive of being able to jump? He could fall off and break more bones. So that's kind of how we have to look at every review assessment. At the time, at that 90-day review assessment, what have you determined from talking to your member? Because you've already established a rapport, you've already have had this member for many years. Some of us have cases where we know members for a long, long time. So what at that 90 days, if any, risks are now being told to you by the member themselves, which is the best way to get the assessment done, is if they speak to you themselves, they trust you to let them tell you, because the days are gone where providers or anybody tell us what to do, especially in Indian country. They do not like us to say, well, you know what? You're diabetic, so you need to stop eating sugar. Oh God, that's really not a right way to do a review assessment. Well, no, you can't go to PT in Winslow, because from Window Rock to Winslow, it's over 100 miles. You can't go there 3 times a day. I'm not going to provide that. It's not cost effective. So those are things that that are on the don't side of review assessment. What we want to do is build up that rapport and gather the information from the member the best way we can. Whether it's in Navajo, whether it's in Spanish, whether it's in Tohono O'odham tribal language, each and every one of you are the expert, the subject expert matters with our members, because each and every one of your plans know the cultures of our communities, and they're all different. They're all very different. So we're going to find that throughout the person-centered planning, is the member is the one that is going to drive this interview. The days are gone when we're going to go in there and say, I'm here. And that's what everybody's been hearing lately. Those are examples. Oh, it's too long. Why do you need to really get into my personal life? You know, it's none of your business. And that's fine. That's really fine for them to say. You don't need to keep pushing them, and you know, we don't want to. I wouldn't want to hear from anybody, well, I have to do this. This is my job. You know, the state of Arizona told me that this is the new form we have to use. You know, we don't want to answer like that. We don't want to talk like that to our members, because that is defeating the whole purpose of person-centered planning and letting the member drive the interview or the review. So we're just going to say, okay, respect their right. And then you may just document that the member, you know, deferred from answering this question. You know, go from there. And excuse me. So there's going to be a lot of creative thinking outside the box when you come up to really get into your own groove, your own time management, your own organization on doing these. And a lot of across the board, all you guys have been doing really, really great so far. We're just here to touch up on some of the questions that you may have. So next slide. I'm going to give the floor to anybody that has any questions regarding a case that you've come across. We're here to discuss it. I want everybody participating, collaborating, feedback, even if it's negative. I mean, we don't want it to be, but if you've heard negative comments from your member and you just can't figure out what's the next option, we want to hear about those. That way we can all talk about it and see what we want to do is learn from each other. And, there's a lot of things that come up that in a group session that we may not have even thought of. So I would like to open up the floor now to any questions and any specific challenges regarding risks when you're completing your review assessments. Or successes, if there's anybody out there that feel that they've had a really, really successful story, please share it with all of us.
This is Niana.
Go ahead, Niana.
So, with the assessment itself, when I was talking to one of my members about the goals, and they really didn't know what the goals meant, but when I told them, I said, it's something that you look forward to that you want to do in the future, or it could be now that you're already doing. And then they started listing a whole bunch of things. I even have a young man who is quadriplegic. He's interested in going back to art school. So he called me last week and he wanted to do that. So what I did was I looked up some art school for him online, and he gave me his email, and I emailed it to him. So he's just mailing the whole assessment out to them. They're reading it. They're actually reading the assessment, and they're saying, hey, I want to change this. You know what? I want this, and I want to. Can I elaborate on this part? So those are some of the things that are happening with my cases, and it's like I'm changing them almost every week. So that's something good, because I think it's good, but it's more work for us. But it's something good because at least now they have a say. And that's all I have to say.
That is awesome, Niana, and that is the perfect example of first of all, you kudos as a case manager to take that initiative to start working on helping the member meet their goal. That is really great. That's one of the areas, and we're going to get into goals in a little bit, but what we want to do is we want you guys to share with us what other, I mean, that was one that was perfectly, it turned out well, and hopefully he can get enrolled, but that's where it's at. When they know that you're taking that initiative to really help them and to advocate for them, then that's when the outcomes are the best. And that's what we want, is we want those positive outcomes for every member. Because I've said this before, case management is not, you have to think of case management as, and then what? And then what's next? What is next? Okay, you got him the application, you gave him that website. Now you're empowering him to have that self-confidence, that self-esteem to take the next step and apply, because you can't apply for him, but you did a great job by giving him that resource. Great job, Niana.
Mm-hmm.
Anybody else?
Has anybody had any successes that things that you've done and or ways that you've gone about it that have been helpful that you could share? We don't hear anything but crickets.
This is Marie from Navajo Nation. Maybe I can ask Deidre, the course, how's your PCSP going? Have you had any issues or any successes with yours? Thank you.
Hi, Marie. We're just going with the flow. You know, of course, ours is like a diverse because we deal with so many different tribes. So we're just doing our best to keep going. As far as successes, again, we just go kind of streamlined, like Nayana said, just kind of give them an idea of what to look forward to, what they want to accomplish in their personal life or either health-wise. I mean, that's all we're doing, basically. And when we first started, a lot of them were very, they weren't setting goals. They weren't really engaging in the assessment. So we ask questions in a different format, kind of like reword the question a little bit differently so that they can come out and tell you exactly what they want. So we just change the questions, tweak them a little bit, and then soon we have a whole huge list of goals. It just comes out if you ask an appropriate or a question. So we kind of just relate to the members and, you know, just go with the flow.
Deidre, do you guys have questions that you've written out that you save and take with you? Is that how you do it, or what is it that you're doing?
My case managers have their own flow, so I think they're on the call. I mean, they're more than welcome to share. I know that Mr. Jeremy Baer comes from a behavioral health background, so he has his narrowed down. He told me that the person-centered assessment is more like a behavioral health assessment where he, you know, was previously working with. And then most of it is just condensing everything. So they have and trying to get their own flow going on what works for them. So there's not really nothing that we go by. We share information, or if somebody comes across an issue, they're really good about, you know, a quick huddle and just asking a question. Hey, you know, how do you ask this question? Or is there another way that I can ask this question so that the members can feel more comfortable giving more information? And we kind of info share.
That's great. That's really great.
So we collaborate as much as we possibly can. Sometimes we do it through text, you know, because we are still working in and out of the office. So, you know, I have my case managers on a group text to where I check in and they check in and any questions, and either that or we do a little Zoom meeting, you know, whatever works for us. But when we're in the office, we get together and just talk about the challenges and, you know, what we can do to make the assessment a little bit better.
Thanks, Deidre. I knew I could get something out of you.
You're welcome. But if my team is on there, Jeremy, Kaven, Carol, you're more than welcome to share because you guys are out and engaging with the members. So if any of my team members are on the call, please share.
Yes, we'd love to hear from you.
Thank you, team. This is your time to shine.
Thank you, Deidre. Would anybody else? I know that there's a member out there that somebody is struggling with, or if the supervisor's here, if it has been staffed with you, is what is our strongest recommendation. Is the only way you're going to learn as a team is from each other and teamwork. So we really recommend if there's a challenge or barrier, you staff it within internally with your office, see if you can come up with something. And I know that there's probably been some instances where a member,
Cheryl, they can't hear you.
She can't read the chat while if she's
oh, I'm
presenting.
sorry.
Oh, okay.
I'm sorry. What? I'm sorry. You can't hear me?
No, they couldn't hear
Now
you.
we can.
Oh,
You were really, really faint.
oh, I'm sorry. So, I know that there's been a case where there's been a challenge with risks that have been identified by a case manager. So please, someone, let's discuss it. Let's learn from each other. If someone has an example without giving any PHI, let's talk about it.
This is Rachel, the Tribal ALTCS. It's really, really quiet. The purpose of this meeting was to have everyone collaborate, this is basically an update of how person-centered planning, the tool, the assessment, all in all, the person-centered planning has been going for everyone. Getting that update is really critical to some of our plans, because some of our plans are having a challenge in certain areas, or they have questions or concerns. Maybe those plans could chime in now to say, hey, we've had this issue. How are you working it? What are some of the things, like being more specific on the risk part? Because across the board, we only got 4 responses from 4 tribes. So there has been some feedback. Maybe they didn't have time to complete, the other plans didn't have time to complete the survey. We were under the assumption that all the other 4 plans were doing good and great. And not only were we going with our assumptions, but at our monthly COVID update meeting, we were getting really good responses back in those meetings. So we kind of tied it in together to say, okay, there's 4 plans that specifically mentioned the risk. Is an area that we really need to touch up on again. Supervisors needed a little bit more in-depth information and training. So this is the time to please speak up, because the plans who have questions, it's, right now is the time to ask them, because it's not time to be shy or be afraid. No question is stupid here, or we will not look down on you. That's not the purpose of this meeting. We really, really want to have all the plans to collaborate, because you guys are out there in the community. Your staff, your team members are the ones bringing you the issues to you, the concerns to you. What are they asking you? What are your case managers asking you? Are you getting any feedback about the person-centered planning, especially the risk part? If it was listed as part of the survey results, risk, what are you guys hearing? What are you guys, what is being relayed back to you from the member? This is the area that we really, really want to touch up on and help you guys, or we can all help each other to have a clear understanding. I had to have a quick huddle, even at the access level, with my team the other day to say, what is your definition of a risk? And I really rely on my team and their feedback and their expertise to get a clear understanding. We even reached out to DHCM to say, can you please go over this section with us again, just so we all have a clear understanding to be able to communicate this appropriately. So, just like we reach out internally, externally, and within our team, we're hearing feedback. So it really can't be silent, because there's been a couple of risks that were brought to our attention. And we really don't want to be the one spearheading this meeting. We want to make sure, because we heard it from the supervisors, we want the supervisors to speak up and say, hey, this is what we've been dealing with. How How do I market? When do I sign a managed risk agreement? When do I just do the rights restriction? What does rights restriction mean? Those are some of the areas that we really want to touch up on in this meeting.
This is Diana again. So I'm dealing with a member that has some suicidal ideations, and I'm kind of like, when do we take him from that facility and place him into another, a step down? I'm just wondering when that's going to happen, because he's been in there since a whole year now, going on a whole year.
Diana, may I ask what kind of facility he's in right now? Is he in a
He's
birth?
He's in a H placement. He's in a H00018.
Okay, that's a birth.
Yeah. So I'm wondering how long, how much more. I did submit stuff to Vanessa, but I'm like, when I talk to the individual himself, it seems like there's nothing going on with him, but that's just me. I haven't seen him in person. So it's like, okay, I can't tell over the phone or anything like that. I just read their documents and stuff. But the thing is that he's been there for a whole year, over a year. So it's like, okay, my issue is like, when do we decide and when do we make plans for him to go into a step down?
Well, Diana, it really
Hey,
should
Sonny, before any one of my team answer that, can someone else from the plan share their experience and how they would go about it? Can someone else speak up and speak to that, Diana's scenario or real life scenario?
This is Carol Mullet. I think that it's kind of up to the facility to decide that. If that person's ready to leave. My thought.
Yes, that was good.
And how did you determine that, Carol? I don't mean to put you on the spot, but that's a really good start.
Well, I had one that came out and just asking the facility and reading the notes. They're the ones that decided to determine that they were ready to be placed into an assistant living.
That's really good, Carol, because the responsibility of a birth is not to have a member in their facility as a long-term care resident. That is what is an access policy. And that's what we have been trying to educate and have more awareness on that, so that case managers, that we all know that the birth is not a long-term care placement. What the birth's responsibility, and I don't want to say that this is all of them, but the one that Carol just now gave an example of, their discharge planning is appropriate, because we all know that the rate for this setting is really high per day. So what gives that birth an incentive to discharge that member if they're getting that much per day. They may say, oh no, the member's not ready, the member's not ready. But as a tribal ALTCS case manager, pre-COVID, remember this is pre-COVID, and we're not just talking about right now, the present, we're talking about pre-COVID, we're talking about during a public health emergency, and then we want you guys to use these things that we're discussing now in the near future when these cases are coming up. And that is that's the biggest risk right now about what is happening, is that we are not able to see each other face to face. We are not able to be in our normal environment. So it sounds like Nyana, if just speaking to him on the phone gives you that feeling in your scope of work, your scope of work, that he does not seem to have these suicidal ideations verbally, or what is he showing some kind of action? Because actions, they say, speak louder than words, but you don't know because you're not seeing him face to face. The facility could just say, oh yeah, he did this today, or he said this today. So that is a challenge. So maybe we can discuss that now.
That's really good, Ernestine. And Carol, your response was perfect, because it's all about case management. Like Cheryl said, you know, when the case managers, they receive all the documentation from any provider, whether it's a referral or any updates on the member status, even in a skilled nursing facility. Right now, during the public health emergency, a lot of our case managers, even on the managed care side, they're not actually visiting the members. So what happens is a lot of their reviews are done telephonically, or it's done virtually. So what does that mean? Vanessa could really speak to this, because she is now reviewing the births. She's the one that's responsible for reviewing all these births. She's working with the behavioral health team, our nurses, behavioral health nurses, to really pretty much buckle down on what some of these births are doing. They have, in some instances, they were keeping our members longer than 6 months, which is what's in the policy. And so, like Carol said, you know, reading the notes, you know, the notes that the facility is keeping on these members, the progress notes, what's going on. And even before, it all starts even before you place that member. Is this the right facility for my member? What can they offer? What types of sessions do they have? Counseling? Are they culturally sensitive? These are the questions that you, as a coordinator, a case manager, you're coordinating these services. In that policy, in the birth policy, it really outlines before you place the member, these are some of the things you should ask for. You know, is this going to be, is this facility going to be successful to and have the member discharge ready within the 6 months? And really iterate that before you place the member, you know, because if you know the policy and say, look, in Access's policy, it states that at birth, we cannot keep our members longer than 6 months. What type of programs do you have here that will help my member? Because this is what's going on with the member. And of course, I'm sure they'll do the behavioral health assessment, and maybe they have already done a behavioral health assessment to at least provide to your provider to say, these are some areas we really want the member to work on, and then follow up, because we're not doing the face-to-face follow up, even telephonically, you know, update, call and say, how's the member doing? Vanessa is getting, she could probably speak to it, where she's now getting some of these birth requests, and it's very vague. There's not even updated clinical notes, behavioral health notes. And she's asking questions like, you know, what's going on with this member? These are the same notes from last quarter. I'm getting the same thing again. So the notes are really, really important, and it'll help you guide you during this public health emergency.
And this is Kevin. I was going to add on that. It's what Rachel was talking about as well about pre-planning, absolutely from admission to discharge. But I think too, you have to start looking at appropriate placements as well. You don't want to be, if you think that your member is going to be in a berth for let's say 90 days, you really have to start planning way before 90 days to make sure you have an appropriate placement, and they will have that bed, a room available for them when they discharge. And then also, I think it's very important to make sure you have some type of care team. Depending on what facility you have, you should really have a care team, and you may have to lead that team if you have a member there that's, let's say 90 days, and you think, well, maybe meeting every month might be a good idea. And you might have to drive that. You might have to make sure there's a meeting that goes on. You obviously taking notes, getting everyone from the care team there, the guardian, obviously the member, the staff from the facility that they're actually residing in, and if you can, staff from the placement that they will be moving to. So there is a lot of, I'd say, kind of the heavy lifting at the beginning and during the time that they're actually, let's say, at the birth. But it's really worth it at the end when you have a nice smooth transition. They're not all smooth, but it makes it a lot easier when you have those details fleshed out and can kind of move forward. So that's a couple ideas that I would kind of throw out there as well.
Thank you, Kevin.
Sure, yeah.
Diana, I just have a question. So when you talk to the member, because, person-centered planning and even just interviewing really has a lot to do with getting them motivated, you being motivated, us being motivated in anything we deal with in life. What is our attitude? What is our motivation within our jobs, within our family lives, within our community? What is it we need to have that self-awareness of, okay, so I know, oh my gosh, this member has been so challenging. Am I going to go in there with the attitude that, oh God, I don't want to do this. I don't want to do this. I just want to zip through this long 28-page thing. I know I'm going to come across and have to document. If we're going in like that, then the interview is not going to go well.
It's doomed.
It's just gonna put so much anxiety and stress on the member, and it's not, again, going to be member focused, person centered. It's not going to be. And right there is where we as individuals in our daily lives, in our community, in our family lives, in our work life, we're doing a disservice to everybody that we're going to be in contact with if we come out with that kind of attitude. So my question is, Diana, have you ever asked him, hi, so-and-so, what, how are you today? What kind of day are you having today? From there, what is his response? Is his response every 90 days? Does he say, oh, I don't want to live anymore. I don't like living here. I don't want to live anymore. Because just from him, he's the most valuable part of that interview is that person. So just from him, you can gather what kind of mood he's in and gauge that on what the staff is telling you. And then from that point on, if the staff continues to say, oh, he's like this, he's like that, or being honest with him, inform him that, oh, every for me to continue your services, the staff here, give me a report. And you have to be honest with them because it's about them themselves. They reported to me that last night you said you wanted to kill yourself. Is that true? I mean, he can say yes or he can say no, but that's also going to show him that you have an interest in his plan, in his life, that you're somebody that cares. And you've already demonstrated that by the previous example you gave of your success story. So has he ever, stated anything to you to contradict what the documentation from the birth is giving you. I don't know, that would be something that you might, follow the trend on and see, are they just keeping him there just to get the payment, or is his well-being, wellness, safety, is that their main priority? What is their priority for your member, your tribal member? Thank you.
And I'll add on to that too, Niana, is that at every 90 days, as Kevin said and Cheryl has said, is that every 90 days, according to the policy, there should be a discharge plan. Now, it doesn't necessarily mean that he is going to get discharged right, this, in the next month or whatever, but what is the discharge plan? And that needs to be gone over every review and go in depth. What is the plan for this facility? And they are the experts on that. But as Cheryl said, listening to that member is also key. So anybody else?
So this is what, every time I talk to the member, and I try to call him every week, he shows no signs. I mean, I'm telling you, he is so happy to take my call. He is so excited that I'm on the phone talking to him, and he's just really happy. And I ask him every single time, how are you doing? He says, I'm doing great. I feel really good. This is what I did today, I know that it's brought on because of his dialysis. He's depressed. I know he's depressed about it because he says what really in the beginning when I first talked to him, he mentioned that he did not like dialysis. He did not like dialysis, but he did not say that he wanted to die. None of his conversations have ever been about him wanting to die. That's the thing. So that's why I'm wondering what, he's so happy. He may have amputations and he's going to dialysis. And although I haven't met him yet, he's really happy. And he's totally different from what I see on the paper.
So on the paper, he is threatening suicide, is what you're saying.
Yes, on the paper
Still.
It says something totally different. But when I talk to him, nothing. It doesn't give me any indication, nothing. And I even told him, I said, well, this is what they said. He goes, what? That's all he said was, what? And then I even told his family rep, and his family rep said, I've never heard of him voicing that. He never said anything to me about that. And the staff never told me anything about that. So it's like, what's going on here? So I'm kind of like wondering what's going on is right.
So Diana, how was he placed over there? Obviously you didn't place him there. Who placed him there?
It was the police department.
Okay, so he probably went into crisis.
Mm-hmm.
Does he have any substance abuse disorders?
In the past, but what happened was that what landed him in jail was because of the sexual. He said it was his spirit that told him to touch the lady. So when the nursing home found out, they did their investigation, they immediately called law enforcement. He ended up in jail. From there, he ended up at the facility. So that's how it went. But nowhere was there anything indicating, maybe in the beginning, but he may have said something in the beginning, but throughout our conversations, I have not seen anything like that. He has not voiced anything to me like that. And only from what they're telling me, and neither has the family rep. He hasn't heard him talk like that as well. So we're just kind of like, huh. And they're asking me, well, what should we do? And it's like, I am the case manager. I'm just managing the case right now. I'm just making sure that he's safe and he's getting the services he needs and what he needs. So far, he hasn't said that he wanted to kill himself. To me, that is. He never voiced that. He's always telling me that he's really happy to hear from me again. And he did this today, and that he's really into sports, really into sports. He likes to watch TV a lot, sports, and he talks sports, and that's what we have in common is because of basketball. I used to be a basketball player, and he really likes to watch basketball. So we start talking about that. So that's one of the things we have in common, and that's probably why he gets so excited when I call.
That's awesome.
Probably.
So those are some of the things that I linked up with him, and that's why I'm saying, when is it due? Because I don't know if it kind of makes me wonder, like what you said. Maybe it's just the facility wanting the money.
Okay, so one of the things that I would like to ask everybody else, so you've heard all the conversation regarding that he states, and Diana in her scope of work has determined that he has a good level of consciousness, competency, good level of understanding. That's one of the key things at the beginning also that should be assessed. In her scope of work, she says she has not heard from him. He has not stated, expressed, or even showed her any signs of suicidal ideations. What would any other of you case managers out there that are on this call, what would you do next? Do we have some suggestions?
Yeah, this is Deidre. We had a case like that in the past, and same scenario, dialysis, depressed male. It wasn't so much suicidal tendencies or ideations. I think it was just, he was just tired of dialysis. He was tired of being sick. And I know sometimes he would express, I wish I don't have to suffer like this. Sometimes I just think about quitting dialysis. So, 2 assessments went by. He was admitted into the hospital. The nurse had called and said the same thing, his wishes. These are his wishes. So I got on the phone with him and I explained to him his choices, his end-of-life choices. I told him that, he has every right to elect any type of hospice if he chooses to, and explain what hospice is, and also explain palliative care. I told him that if he feels and thinks that he's just suffering and so tired of living with his treatments, he does have that option. I know in a lot of cultures and traditions, you're not supposed to talk about that, but I think just stepping outside of that and giving him real life choices, it helped him open his eyes a little bit about his future and what he really wanted and what he was really saying. So I had spoken with the nurse, and one of the social workers from the hospital had talked to him about hospice as well. So it wasn't so much, him wanting to commit suicide or this and that. I think from time to time, the members just get so tired of being sick and so tired of going to the hospital, being poked and prodded, that sometimes they just wish it would end. And I know that sometimes that gets misconstrued, but I think explaining to them what resources and what rights they have and making their own choices, if they are their own power of attorney, definitely helps them. So he, after that, had that talk with him, he kind of, he did stop wanting to not live. You know, that talk kind of went away until unfortunately, you know, his life ended. But I think just giving them the resources and educating them on what's available helps them a lot.
Great, thank you for your feedback. Anybody else have any other example or suggestion on what could be the next step in a situation like this? Okay, so one thing I wanted to add is that when a member is on dialysis, and usually, and I've seen from a lot of the service plans, a lot of our members have end-stage renal disease, which means they won't survive without being on the dialysis machine 3 days a week for 4 to 5 hours a day. When you come out of dialysis, and this is a personal experience because I had to be for 1 week in a medical emergency that I suffered. It is a horrible feeling afterwards. You just feel so tired and itchy and just uncomfortable. So think about it. A person going through that every other day for that many hours a day, that will wear on you. That will get you depressed. That will want you to feel hopeless. So just remember that when you have a member in specialty care like dialysis, you have to try to remember to collaborate with the dialysis medical professionals. Every dialysis has a nephrologist, a kidney specialist, doing their care as their medical professional. Every dialysis unit has a social worker in that unit. Every dialysis have medical techs that you can, talk with just to say, have you ever heard this from the member? Because they're the ones that monitor them through that 4 to 5 hours every other day. They watch them in the chair. They see how their mood is while they're there. I've seen people laughing and making friends with the person in the next chair. I've seen some, watching TV and watching their favorite show or soap opera on there. Or I've seen some that are just there, just weak and sick. So make sure that you really start collaborating and coordinating with any of the disciplines that are involved with the member, because I tell you, you can get the most valuable information from those sources. So thank you for sharing that, all of you, regarding that. Especially, again, person-centered planning is the members' preferences, what they want for their life. Thank you.
Okay, so I know we touched on a lot of things. What we did want to do is get some other feedback on literally the form itself, the managed risk agreement form. So we kind of want to know who's developed their own management risk forms. So does anyone out there, you kind of created your own, is it like a hard copy, electronic form? Can anyone kind of just describe what you use as your form managed risk agreement, other than the one that we have for access?
So everybody is using the Access MRA?
Yes, Native Health is using the Access MRA.
everybody else then? And in using our form, we'd like to do is we want to update it and kind of customize it to make it, user friendly. Is there any ideas or suggestions of how you would look at that form the way it is today and how we can make it better for the future? So any suggestions at all of how we can make that form better? Like, do we put other areas in to talk about any type of rights restricted areas? Is there enough area to give detail on any of the risks that have been identified that need a managed risk agreement? Drop downs, a fillable form, kind of like things we've done in the past. Any ideas like that you think would work?
Ernestine, could you go ahead and explain what it was you were talking about, page 2? Ernestine, are you here? She might have dropped off.
Okay.
Or maybe she's on mute. I'm not sure.
This is Carol Mullet. I think I would like drop downs so it would give you the option instead of, trying to decide and figure how to go around this. An example, I have a member that's wanting to go home against the advice of everybody, and he has a lot of risk associated with him going home, and a lot of it has to do with health. So as far as what is the risk, describe the risk, what is it, the factoring, contributing to risk, health reasons, like if he's amputee. I mean, a whole list of factors that contribute to that are already listed would help, I think.
Okay, sounds good.
My opinion.
Yeah. And I'm thinking too, what we could do is maybe we'll send out a form. We'll have this collaborative. Obviously, in the future, we'll talk about this a little bit more. We could just take everyone's ideas, maybe over the next 4 to 6 weeks or so, and give us your ideas what you think we could do. We'll improve it. We'll send it out. Again, it'll be just kind of a collaborative effort to make the form work for as many people as we can. Obviously, we're not going to be able to have every bell and whistle on it, that's for sure. But we thought of just going through, getting prepared for today, just looking at some of the actual document itself. We said, boy, maybe there's a way we can make this, a little more informative and detailed. So when you do identify you do have to do the actual agreement, it will give you enough literally room. And like you said, Carol, some drop downs and other information just makes it that much more defined to use. So again, we'll probably be looking at this in the next 4 to 6 weeks. Maybe we'll make it into one of our famous, I think now we're kind of famous for the fillable, which actually worked out pretty good. So we'll keep this on kind of the top of our agendas, especially that when we meet with all the plans, get your ideas and kind of move forward with building the new managed risk agreement form. So,
Kevin, I would like to read what Ernestine did post. She said that her mic isn't working, but she said, what is his understanding about his mental health? Does he have any areas of mental health he wants to improve, etc.? So that was her input.
Yeah, it does inform. Great. Thank you, Ernestine. That's fantastic.
That is good.
Yeah, that's really good. Okay, well, with that, I will start the video. It's a video that Rachel picked out. I hope I can get to it. And just make sure, just let me know if you can hear the audio. So here we go.
In the past several years, it has been transitioning to a
Can everyone hear it?
support system for home and community-based services.
Yes.
Person practices. We use person-centered practices because they focus on each person's abilities and strengths and increase people's quality of life. People who receive home and community-based waiver services have the right to choose which services they want to receive, who delivers the services, and where and how often the services are delivered. In Minnesota, we encourage people to be involved and engaged in making these important decisions. Here are some ways providers in Minnesota are providing person-centered services.
My mission is to find that person-centered care. I always say to my gals, when we have 40 people here, we have 40 different people here, and we need to make sure that we're trying to meet their needs as an individual. And, you know, everybody has goals and interests and and I feel like when they come here, they know that they're getting that. They know that when they want to play dice, we're going to find someone to play dice with them. I want people to come here and feel that they have a quality of life and they have value and there is a mission and to stay healthy and stay active. I love my job. I love what I do.
Really important to know the residents that we serve and be creative, have fun, enjoy them while they're here, provide those meaningful activities. And if there's an opportunity to do something, try it. And then just really getting to know the client and having an open mind, flexibility, creativity to really focus on that patient-centered care. And just through conversation, you might spark an idea. Some of the things you don't think that they could do anymore or are available to them, they really are. We have a couple people that really enjoy woodworking, whether it's running a screwdriver or anything that feels really gives them purpose, that brings back a passion and a confidence that they have. Individualizing their care plan in a way that, with the previous woodworkers, the staff spend a lot of time just thinking of different projects to keep that woodworking ability in place and really making that client happy. Anytime you can take somebody and make their day better and they can look you in the eye and they thank you and you know you made a difference in their life, that is huge.
It's a whole lot more fun. Just stand by yourself.
I think that we just need to all just stop and just hear what somebody is telling us. Go in with your ears tuned into them, hear any little clues that you can hear. I've had a consumer that had been with Sept on 3 different occasions. This time when she came back, I just took a whole new outlook on what she was really looking for and what she really needed. And she was telling me how she likes to be creative. And I asked her if she would like to dress our female mannequin for. And she became real excited about that. So she puts out the clothing, she puts out the accessories that go, and she is able to express some of her creativity. And that was the desire of her. She wanted to be creative, wants to be independent, and is willing to go to the work to get there. So we need to look at the little things to build up to the big. And it takes time.
Person-centered planning is important because not everyone is the same and we want to treat people as individuals and they want to be treated as individuals. Supporting people on an individual level is critical. Every person inside of them has gifts and talents and purpose that they can give to the world. So we need to be aware of that and make sure we're serving our population the best that we can. Know your audience. Know who you're serving. So looking at the things that they want to do in their life is very important.
I feel like our team members do a great job, especially our life enrichment team, in really getting to know the residents.
So I think a really important thing to do to get the person-centered plan is to build trust, build those relationships, sit down, get to know the residents. I think once you build that relationship, they're more likely to open up with you.
And again, it's that exuding of respect towards the person. And so today, when we look at person-centered planning, it's that person guiding the team and telling the team what it is they want, and then us assisting them to make the plan to get to where they want to go. Someone here who's doing rec and leisure said, tomorrow I want a job in the community. We're going to figure it out. We're going to make it happen. Carrie came to us. Carrie said, I want a job in the community. I want to get married. I want to live independently. Well, today she's got her independent job. She's engaged. When she first came here, she was on this very structured behavioral plan. We've been able to put the supports in place for her to be able to realize her dreams. It took her a little while, but she did it. Was going on crew a lot more. I had opportunities to go to all different places. Once she was out on crew, she decided, you know what, if I can do this, I can go and I can work my own job in the community. I worked with a job coach from functional to get me a job outside of functional. I now work at a gym in Health Fitness Evolution in Monticello. I think what's really interesting about Carrie's journey is that we watched her grow into this person we never thought she could be. It isn't a place that we regulate what you do, how you do it. You come and you live here. You're able to bring the things that you want to here, decorate your apartment like you would your own home. We had a lady that was really hesitant on moving in. And I said, well, what were the things that were really important to you at home? What do you want to take with you? And she said, my perennial garden, the flowers. I loved gardening. I said, you know what? Let's find you a place. And we found her a place to garden. And it actually looks right out her window of her apartment. So she can go. She takes good care of that garden. So it's very important to her. So trying to find the things that are important to the people that move in here and bring that with them and be able to give them the things that they would have when they lived at home. Everybody has a different need. We can't group everybody in the same category. We really base each person's needs on where they are at and make sure we can meet those needs.
So can we have some feedback? What did you guys think about the video? Hello?
Is anyone there?
I was going to say, did everyone see the video? Did everyone hear the video or at least read it?
It's Carol Mullet again.
Thank
Awesome.
I thought that was
Yay,
a good idea because a lot of my older members, they think back of when they used to work in the fields or when they were farming. So that would have been a good suggestion of maybe putting a garden in front or something. I never thought of that.
Well, good. That's really good that it's opening your minds. Anybody else have anything they want to share? What they got out of that?
It just reminded me of one of my members that had expired last year, no, about a year and a half ago. He was so happy when he was outside in the garden. And that's what he loved to do, even though he had dementia. So it just kind of reminded me of about him.
Thank you,
Awesome.
Diana.
Thank you.
That's great.
I remember back when I was a case manager, one of the facilities near the reservation, skilled nursing facility, they used to have activities for all the Navajo residents. They built, they got donations, and somebody did construct some small tabletop weaving looms for the grandmas and grandpas that wanted to weave, and they would use all different multicolored yarn to let them use to weave their own patterns. And when they were completed, they hung up those little rugs, woven rugs throughout the facility. And then another one towards more south, but where we had a lot of Diné residents down there, also they had anatomical posters on their walls near the shower or within the shower rooms, and all the anatomical parts of the body were in English and in Navajo, so that helped the CNAs or the medical assistants when they're giving the AM and PM care to the members. So there are those facilities that really, really go above and beyond for our members. And again, you know, I guess as tribal health plans, you really have to look at the providers that are allowing to come onto the reservation, or the providers where our residents are, that they do go take more steps to make sure that our members have a good quality of life, because this CMS initiative of person-centered planning is not just case management, it's across the board for every single Medicare beneficiary. Thank you.
Thank you, Cheryl. Okay, let's go on.
Head, Cheryl. Sorry, Kevin.
Yeah. No, you're good. Okay, Sonny, if you want to cover the person-centered goal setting.
Okay.
All
All right.
Before you go, let me just really quickly touch up, just give a real quick highlight on what I took from the video. You know, one of the things that I really wanted to highlight is that, you know, these were all different facilities in that state, that how they incorporated the person-centered planning within their facility. The next thing is, one of the things I heard is don't regulate. You know, they do not regulate. You know, they always put the member first. What's important to the member was really something that we all learned in that person-centered planning training, that we all, you know, leadership supervisors, we've all participated to find out what is important to the member and how can we help with what is important with the member. And then also at the same time communicating what's important for the member. You know, that was another thing that we had touched up on. So in this video, it kind of reminded me of what we've all learned in that training. And then everyone has different needs. It's not like Cheryl, I like Cheryl saying, always saying the cookie cutter. It's not, everybody's not, you know, a cookie cutter. You know, we shape them and mold them, and we want them to do a certain thing a certain way all the time. Not everyone's going to be the same. We have difficult members. We hear a lot about members who are not wanting to give information and stuff, or maybe they just don't want to do a certain, be placed in a certain place. You know, it all goes back to members' rights, and then just wrapping all this up to say that, you know, if there is a risk identified, know how to document. And if you don't, always please, if you're the leaders here, the supervisors attending this training here, if you question something and if you can't resolve it within your team or amongst your team, feel free to reach out to us. You know, we can help you along the way, not 10 months later, a year later, or 3 months later. We want to know, you know, hey, I have a scenario. Can we please schedule something? You know, I'm the supervisor and I want a little bit more information to help my team. We want supervisors to reach out to us so that we can be that support for you guys. Thank you.
Thank you. Thank you, Rachel. So we're going to talk about person-centered goal setting. And those of you who have been a case manager for a long time and talked to members, you know, elders often when they're talking, they reveal things through storytelling. And we've often heard Rachel and Cheryl and all of you talk about elders as being the wisdom keepers. And so keep those things in mind when you're thinking about it. But before the conversation, understand the individual's history. So if you get a new member and you know, it comes across on a PCCR, you're going to see a bunch of information, right? So you can actually look at it. But if this member is one that you've dealt with a lot, you already know his history. If you don't, you know, that's the time to get him to open or her to open up and talk about their history. So understand that history. Understand what that individual's unique circumstance are. What are their circumstances? What is their capability? What can they do right now? Start thinking about that. How much can they move? And Cheryl talked about somebody getting a prosthetic leg and different things. So, and one of the best things you can do is, and I've been out with a few of you onto actual reviews, quarterly reviews, and listen to you, and I've seen some that are just really good at connecting with the member, and sometimes it's hard because they don't hear very well, but if you build that relationship with that member and they know you, and Niana talked about how this man, her member, when she calls, he gets all excited because she has built something with him. They both have something in common, sports, right? So whatever it is, build a relationship with that member. And one thing that we really, of course, we want the member to talk about themselves. This is the time for them to shine and talk about it, and find out what makes that person tick. What is it makes that person unique? What is it that makes that person want to do the things that they do? Just understand that more and really start listening very carefully. And really important to demonstrate interest by listening, making eye contact. If they see that you are really listening and you are engaged, they're going to talk more. And then you learn more. And again, coming back to the members' strengths and capabilities and the different things that they're able to do, or if they can't, but there's something that they can do that is unique to them, whatever it is. It doesn't have to be somebody can get out and run 5 miles. It has nothing to do with that. It's each one is individual, and as we heard, nobody is cookie cutter, so everybody's is different. And we want to tailor that conversation right to that individual. Okay, next. Once you get into there, now we want to initiate the goal discussions, right? So you want to acknowledge and establish that member as an expert of what they're talking about. We don't want to go, no, you're wrong. We want to encourage them to talk and have them share the things that are important to them, things that they enjoy. Really, if you elicit interest, if you're talking to someone and you look at them and you can see they're looking off in the distance, they're not interested in anything you have to say. If somebody is sitting there on their phone and you're talking to them and they're looking down at their phone, they're not really centered on what you are thinking. Now, I know you have to write, so we understand that, but that's where you can be jotting something down. Maybe just have a piece of paper where you just jot stuff down so that you get keywords or phrases, but keep looking up. And it's really important in some cases. I know even for my own mother, who passed away this year, she had dementia, but it was really important and really difficult sometimes for her to articulate what she wanted to say. So I would listen to what she had to say and then come back and rephrase it and help her or give her a keyword here or there, which would trigger that thought if I could see where it was going. And you know your members, some of them you've known for years, some of them you haven't, but if you know them really well, you know some of the things that they like, and maybe they're looking off, maybe there's something distracting them. You can kind of just move them right back to what they were talking about. Also, so if you're going through your assessments and you see something that they've talked about in a previous conversation, maybe they write that down, and when you go through your review and talk to them at the next review, say, hey, I remember you talked about this, whatever it was. Where are you at with that? How are you, is that something you're still doing? Or one thing that a lot of you have, which we all know, elderly people do sometimes wander, right? They do wander outside. And sometimes we don't know why, but maybe that's where we have to stop and say, okay, why are they wandering outside? So if we understand why, maybe we could just say, hey, when you go outside, what is it you like to do? What is it that you really want? Or maybe they just wanted to get some exercise. So maybe there's something that can be done to get that person some exercise outside. Maybe there's a member who could take them for a walk, or a family member who could take them for a walk, or whatever the case may be. Maybe when that member was younger, maybe they went down and they met their family down the road, and they can't articulate it out to somebody. That's what they want to do, so they just wander out, and they're maybe that person is no longer there, but in their mind that person was there. So maybe we have a new, find a new destination, that's something that they can do. Maybe the member just likes to ride along with their daughter, son, to go pick up the kids, and at the bus. I mean, I don't know about you, but I always go back to my mother, because I took my mother with me everywhere, and we go to the store. And during the pandemic, of course, I didn't have her go in, but she would sit in the car, and I would say, okay, lock the door. And she'd lock the door, and I'd come back, and she'd say, you can't believe what I saw. And so she's talking to me about what she saw, and, oh, that was really cool, I saw something, or that was really weird. But whatever it is, maybe you can turn that into, oh, is that something that interested you? Okay, well, if it is, let's talk about that. And for most of us, the sun is super important, right? It just makes us feel better. Now, I know it's chilly up north. According to Cheryl, it's chilly right now, or it was this morning. But still, sometimes just getting outside, even in the chill, if there's the sun coming up, and it's just something that helps encourage their minds. All of us feel that way. I know for myself, I just like to walk outside just to look around and come back in. Then I'm ready to go again. Okay, next. And again, we're going to come back down to articulating the goals. You're going to verify with that member if they have any goals that they want to accomplish. Sometimes, they don't have anything right off their head, but you've listened to them, you've jotted down stuff. So maybe there's, little things you could look down at your notes. Well, what about this? And they can stop and say, yeah, hey, didn't think about that. Make sure that you rephrase it, come back and rephrase exactly what they told you if it's something really important, and then ask them, did I get that right? And so they can say yes or no, and then you go back and talk about it further. Another scenario, which we've talked about in the past, is members who have been incarcerated is, what is it they want? What is it somebody who's been incarcerated wants more than anything? Probably to get out and smell the fresh air. Yeah. Take a walk. See their children, grandchildren, go to the store. I mean, there's all kinds of things we take for granted that we don't really think about until those rights are taken away. And we've talked about risks and taken rights away from members. So now we need to think about, what is it that, the rights that, whatever their health condition is, they feel like their rights have been infringed upon, even if it's not a risk, it's something, maybe they feel that way, but let's talk about it. Get a meaningful conversation with that member. So person-centered goal setting, back in 2019, October, many of you were at White Mountain when we did our quarterly, and we did an exercise. Well, we did several exercises, and several of you gave us some really good feedback on that. And so we did some with some exercise. We were all up walking and telling somebody how to move forward and different things without, blindfolded. We did some with exercises of scenarios, and that's what I want to go over right now. Is so on the next two slides, we have an exercise that we used at that meeting, and I'm only going to provide one because it's really, it's too short, but I wanted to just find one. And each team was told to imagine themselves in their shoes. Could you go back one just really quick? In their shoes, and then they were to give feedback of an action plan of what the case manager could do to accomplish those goals. So when we go through this, I want you to think about it, and we can go through and talk about what the scenario was, what the team found, but I would really like for you guys to also chime in when we're done. I'd like to hear your thoughts. So go ahead and go. Oh, and by the way, I provided the link in the pages in the training manual, and Kevin has made sure it's on the digital toolbox, so it's right there if you ever need to go look at it. And we reference the pages that have to do with that goal setting. Okay, next. Okay, so the scenario that we had back in 2019, one of them was, so you're a 65-year-old elder. And some of you will remember this, right? Because maybe this was your team. You're paralyzed from the waist down. You live in town, but you don't get out unless someone takes you. And you're depressed. And so what are some of the things that you used to do, and we're talking you, meaning this scenario again, that you used to like to do, that you took for granted when you had use of your legs? And the team said he was in construction. So they got to decide what this person did, and they said they were in construction. Okay, so the member played basketball in school. So you're learning this while talking to this member, right? This is the things that they used to do. You love playing with your grandchildren, and you used to love going fishing. So how can we achieve those goals? And next. Oh, back one. I'm sorry, Kevin. I think it's on. It's must have been hidden. Can you take it back off and just let me look at that one?
Yeah, let me. Yeah.
Okay, sorry. I think it must have somehow got hidden. The next one, I think, right? Next one down. There you go, right there. Oh.
Hide slide.
Oh, it's okay. Just it will if you click on. Oh, it doesn't let you in. Oh yeah, no, we're there. We're there, aren't we? Yeah. Okay. Thank you. Thank you. So the team came up with an action plan on how to achieve those goals. Is they said, okay, get the members some physical therapy. Okay, so that sounds like a good thing, right? But that doesn't maybe necessarily sound fun, but it's something that is a good thought, right? That way they're getting some movement. Another thing that they came up with was a network with a family member to get the member into an informal wheelchair basketball team. Maybe somebody just meets with them down there, you know, at the gym somewhere and they play basketball. Or maybe they go outside and there's an outdoor court somewhere they can go play and there's any number of things, if we think about it, that this member can do. Or any members can do if we think outside the box. So the other thing is taking the member fishing. They wanted to go fishing. Well, we provided a picture here. You can see they're in a wheelchair and they're fishing. So yes, it would probably require somebody taking them down there, but that can be arranged. And, you know, find out if the member is agreeable to see a mental health professional. And the other thing they said was arrange for the member to have meals on wheels. And so this is where I want you guys to feedback is what other action plans could you identify that the case manager could do to accomplish this member's goals? And if you want us to go back one screen, we can. Kevin, can you go back one? There we go. Okay, so here's the things about that member again. Remember, the member, 65-year-old elder, is paralyzed, lives in town, like to play basketball, play with the children, go fishing. Is there something else that anybody can think of based looking on this that you could do, some sort of action plan that we could do for this member? And don't everybody speak up at once, okay? Okay. Does anybody have, okay, so Ernestine says, check with community resources for elder activities and provide information. Great. Great. Thank you, Ernestine. Yes. Maybe there are community resources. Maybe there is the elder facility they can go to. And okay, complete the behavioral health service assessment and depression management. Yes. Again, they've indicated they're depressed. So good one. Thank you. Thank you, Ernestine. We appreciate that. Anybody else think of anything? Medication or wellness services? Absolutely. Go ahead, Cheryl.
I was going to say, going back to the slides that I presented before, chronological age versus biological age is 65 is young in what our lifespan is now. So it's like, you know, we might think, oh, 65, that's the national like senior citizens year now. And that is what I think that we also need to be aware of, is the awareness of ageism. You know, we have now read articles or seen on TV, we have 88-year-olds running marathons. You know, we have, we have elders in our communities that are still farming the way they used to back in, you know, our ancestral days. And so we also need to really be aware of that, you know, as of what, just because they're a certain age, what is their body able to do, their mind and their body, because the goals are really, really based on what their what their preference is as to living a good life. As I mean, we in Indian country, we're not going to say, "Oh, Grandma Shabasana, what does your quality of life look like?" You know, we're not going to say that. We're going to ask them, you know, Grandma, you know, what do you see for next week? What do you want to do? You know, and that might be close to the beginning of the month, and she's going to say, "Oh, I can't wait to go to town." I know my mom gets excited when it's her payday, you know, because she knows she can. If the grandkids are here, she wants to take them out, and you know, things like that. So a lot of them out here, they'll say, "Oh, I can't wait to go to town because we need livestock feed," or you know, things like that. I want to go to the trading post or the pawn shop to go pay on my jewelry. That's a goal, is that on a fixed income, their goal is not to lose their valuable traditional pieces that have been handed down through generations. That's a goal, you know? And so the goals, we have to always be reminded that goals have to be possible, realistic, and desired by the member themselves of what they're telling us, so that we can assist them in accomplishing that. So it's a lot of awareness, it's a lot of education, and it's a lot of motivational interviewing, you know. So thank you for your slide, Sonny.
And I wanted to read, Patsy said, what about volunteer work at a desk, a school, or facility? What other things of interest that the abilities does he have to share? Good, very good. Thank you, Patsy. Another one is invite more family with members' consent to complete the PCSP. Some family would respond, "I didn't know that about you." And that's probably true, very true. I know for myself, my mom, she would say something and I'm like, wow, I didn't know that. So very good. Family support is very important. Absolutely. That's what family support is, so important. And when we have members that don't have much family support, we really got to dig a little deeper. That's where maybe the community comes in a little bit more, is because there's not as much family support. But if they've got great family support, you know, we can figure some stuff out. Even it may not, maybe that family member has to work, but maybe in the evening they can come over and do something, right? If the member is willing, or someone else is willing to take the member to a basketball game or school game, absolutely. Maybe that's something that they wanted to do. Just maybe they used to play. Maybe they want to just watch it. Maybe it's a local school. Very good. Very good. Great suggestions. Thank you. I appreciate you guys speaking up. Anything else?
I just want to give a little we're at our time, but if you guys please still continue, if you guys have any other suggestions, feedback for us. It's been a great, you know, meet.
And so yes, I will piggyback on what Cheryl said, is anything that you can think of that you think would be helpful, and how you felt that this little exercise, not just this one, but the whole thing, how do you feel like that? Did you benefit from it? Is this one you're going to go over, Kevin?
I was just going to tell what you're saying. If there's any last kind of what everyone's learned from today, if you like the format, or what, and from what you guys have developed, initiatives you're working on, anything you'd like to kind of talk about, just to share so other people can see what you're doing, help improve their plans, their programs as well. So, like I say, I know we're a little bit over time, but it'd be great to hear any last comments or suggestions, ideas, that kind of thing from everybody. So,
this is Diana. I think that it just reassured me as to how we're doing the assessment, the new assessment. I want to abbreviate it, but I always flob it up. Anyway, the person-centered service planning. It just reassures me that we're not doing it wrong, like what we thought we were. We're doing what we need to do for the members. It just kind of just gave me more ideas as to how to use it. So that was a good plus.
Oh, great.
Thank you, Diana. And one more thing that was posted out here is pen pals used to be a form of connecting. That's telling on a lot of us, right? Our age is we had a pen pal and form of connecting with people. Nowadays, you know, we have internet and Facebook and different things, but I don't know about you, but my mom she would write a letter, although it got to the point where she couldn't write it, but I could write it for her. And so maybe that's something that you can do, is help them write a letter to somebody or have them start telling stories. And one last thing, I did enjoy hearing and reading examples from other case managers. Burnout is real. We need to find ways and hear the voices of our friends and seek workers, even if we can't be in the same room. I miss you all. Thank you. Yes, and Patsy, we miss all of you being in person. But anyway, thank you all. And we're over time, but
Thank you, everybody, for your participation and feedback. It was awesome to hear from you, and we'll look forward to doing any other collaboration like this. And again, we really enjoy the feedback we get. That is what we're here for, is to learn from each other and work as a team. Thank you, everybody.
Thank you.
Thanks, everybody.
Cheryl, this is Casey.
Oh.
Oh no, Casey, you're calling me out specifically? What's up?
Oh, time out. Oh, wait.
I had we have some internet difficulties, and I was trying to listen in on the phone. Then I got kicked off, and I was trying to call back in, but calls were coming in also. So I did hear that it was being recorded or something. How would I access that?
Yeah, so because of the virtual environment that we are all in now, we found it more a better format to start recording also, because while we're in a digital environment that we're in, it's hard for someone to be doing the presenting and then presenting on their slides, somebody to be advancing them. So we decided that we're going to go ahead and record. And once the meeting's over, the recording ends, and then we'll probably have Bandana. She's really savvy at doing that. So she's going to be finalizing the attendance and the recordings, and then she'll send it out.
Okay. All right.
Okay. Thank you.
Oh, and Rachel raised her hand. Go ahead, Rachel.
I just wanted to add, that this was a really good presentation. I was in another meeting, a required meeting that I had to be in at the beginning. It looks like there was a lot of silence. I was hoping that there would be a lot of collaboration and working together, but I see some of you have stated you're having technical difficulties also. So the recording would, you can go back and listen to it and be able to follow along or maybe catch up on areas that you had missed. The team did a really good job in presenting. Thank you for that. Like I said, we are here for you to kind of help you. And if you want to reach out to any of the other tribal programs, you're more than welcome to reach out to each other. I know we're all very busy, but there's I believe 4 out of our plans has been, really reported success with the person-centered planning and what they're finding out with the members. So you're always welcome to do that too, is reach out to each other and collaborate. I believe a couple of the plans have already done that. If you need help or assistance in any area, but once again, we're always here. If you guys want another follow-up meeting related to person-centered planning, what areas, what areas you need help in or need more guidance in, that is our sole responsibility here. One of the responsibilities that we have is to make sure that we're providing as much support as we can as we're trying to get comfortable with this person-centered planning. During the ORs, which has been extended to 2022, we're really going to not look at anything within that year. Effective June 1st. Everyone should now be utilizing the person-centered planning. All plans should now be on their second assessment. If the members are in an H placement or HCDS setting, they should be on their second assessment or starting to do their second assessment now. So, and in the SNFs, if you've done it like late June, and your next one should be coming up in December. So just kind of reiterate and communicate this and educate, do a lot of, if you have to meet with your team, provide feedback. If you have to work with other offices, that's great too, so I do really appreciate the feedback. So we do keep a tally of who's all participating, who has questions, that's why we ask, it's your opportunity to ask these questions now, provide feedback now, so when we have these questions, I wasn't properly trained. No one told me about this. I wasn't aware. That's not how it was communicated to me. I'm really, 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 I follow the policy. I have my team follow the policy. I'm really adamant about my team taking notes and following through with things. So, we document. It's always about document, tracking. We heavily track a lot of things here at ALTCS when it comes to tribal ALTCS. So, we encourage you guys to participate. If you have questions, this whole training was put together because of some feedback we got back from one of the tribal ALTCS programs. So I hope you guys learned quite a bit. And like I said, if you didn't get reception very well, if you feel like, hey, I went over the slides, I went back through the recording, I still have questions in this area, feel free to reach out to Kevin and he can post it out there again and say, how many of you want more training? How many of you need this? Because, we're constantly trying to add more to our training so that you have resources available to support you as a leader at your level. So thank you very much for participating, everyone.
Yes, thank you.
One more question.
Okay.
In reference to the form, like the Medicare area where it asks for Medicare, then the handbook area, the Medicare, I just kind of feel like it's a duplicate because it's on the face sheet also. But I just want to throw that out there. Then the handbook also is when they're reviewing, case managers are asking me if they have to provide a handbook every 3 months, and I tell them no, only once a year. Then they're saying, well, why do I sign this? And they're just acknowledging that that you reviewed it, and just keep track of when you gave it. That way you don't have to give it every quarter. then and then the form, I'm telling them to keep it together because how our case format is they're split up like into areas. They're tapped out for goals like service plan and all that. And some case managers were splitting up that whole tool, and I told them to keep it together. So we're Navajo Nation Pies, they work on kind of redoing their case file setup.
That's awesome. Yeah, that's a good idea because we don't tell each tribal health plan how to set up their files. That's totally at your discretion how you want to do that, how it works for you, because quarterly you guys will be doing your supervisory audit. So we come out every 2 years by mandated by CMS to do the audits. But as supervisors, you guys are going through your supervisory case audits every 90 days. So whatever works for you in that case, yes, because it's a person-centered planning and that's the tool now, it is recommended that it stays all together instead of sorting out each page. Thank you, Casey.
Okay, thank you.
And John L. said that I think the more we have these PCSP support meetings, more case managers will have questions. Since this was the first meeting, I wasn't prepared and trying to keep to other duties as well during this time. I do appreciate listening to your suggestions and discussions. Good.
Thank you, Janelle. That's really great. And that's what we're here for. And that was the point and the purpose of getting together and again, learning from each other, collaborating with each other so that there's processes improvements, and also for us to continue on into the future as being partners to make sure that our valued tribal members, our members with disabilities, are having their needs met to ensure that they live a good life for however long we are all here. So again, it's with much appreciation that everybody took the time out to come and join us, and please share it with your staff that couldn't be on here because we know that everybody's busy. So thank you, everybody.
Yes, thank you.
Janelle, I think you just gave our next meeting a name, Person-Centered Planning Support Meeting. Thank you. Have a good day, everyone.
Yes, thank you.
Hasta luego.
All right, bye.